Breathe in for me. Breathe out. When I first started nursing school, I thought I needed everything. On the internet, people are saying you need this and that and this and that. Pause. Please pause. If you're interested in becoming a nursing student or you're already gonna start nursing school, as a nursing student on semester 4, please let me tell you what you actually need. Now, before we start, give me 20 seconds to introduce myself. My name is Tyra Faye. I'm a Christian nursing student, and you are in the midst of my digital diaries. Yeah. I like to document my days, my faith, and self-growth, and everything quiet in between. For anyone who would like to join my community and who wants a reminder that growth doesn't need to be loud, welcome to my little space. We're gonna start with categorizing in 4 equal parts. First part is gonna be about your classes. Second is your clinicals. Third is, of course, self-care, which is a must. And fourth is going to be the most important one of all. I wanted to kindly remind you that everything I'm going to be talking about is going to be on my Amazon storefront down below on my YouTube description. I made it so it's more convenient for you. First day's coming up, we're freaking out. What are we going to do? Let's relax, my friend. Let's relax. The first things you'll need for school, the same things you've been needing for the 12 years of school. That is a pen, highlighter, pencil. Whatever you already been using, you can definitely bring it to nursing school. If you want to make it extra special, you can definitely buy new ones. And if you want to hear some recommendations, I like this highlighter. It has the tip like this, and it also got the tip like this, like an actual highlighter. I would also recommend a pen that has multiple colors. This is the one I have. Honestly, I forgot where I got this from. It has pink, blue, green, and black. It helps you with color coordination. Next thing for the first category would be to have a planner. Now, this planner I got from Dollar Tree because I honestly got planners from everywhere. This is the one I've been sticking with just because it's so simple. This is how wide the thing is. For $1.25, not too shabby. My go-to pencils, of course, if you're running out, all in there. I feel like this is everybody's go-to pencil, especially when it's like slanted, you know what I mean? And for the last part of the first category, you need a bag. Now, this bag is up to you. You can get a backpack. Honestly, personally use a bag, like a tote bag. I had a big bag that had D on it as my, because my name is Tyra Faye. I used that in the first 2 semesters, and then I kind of went to a smaller tote bag. That is the first category. Congratulations, you're already prepared. It's not too bad, see? It's not too bad. Now, this part is probably gonna intimidate you the most, and it's going to be the clinical part. The first thing you will need is a stethoscope. A stethoscope makes it feel official, like, wow, I really am a nursing student. I got a stethoscope. That's how I feel. I'm like, oh my goodness, this is amazing. As a nursing student, I don't recommend getting an expensive stethoscope. Maybe as a nurse, once you get your groove, go for it. But as a nursing student, to pass off checkoffs, head-to-toe assessments, you don't need a $300 stethoscope. This stethoscope I recommend personally is $30. Maybe it was a little less. This one is on Amazon. It got me through everything I needed to get through. It took me 2 semesters in to learn that there's 2 different sides and it turns on for different sides. There's a green little thing that will show with that one right there. And if you see that on that side, that means it's on. The stethoscope is not only this, it's actually both sides. You're trying to hear something from this side, but you see the green on this side, then you got it wrong. To move it, twist it, and now the green is right there. When you're putting the stethoscope on, make sure it's sticking out, not sticking in. Breathe in for me. Breathe out. All right, you got clear lung sounds. After the stethoscope, what you will need is a pen light. You can get a cute little pen light. I have some recommendations on Amazon. This is the one I have. This measures basically the pupils. You'll need to also bring this for clinicals because when you do focus assessments, you want to see their eyes. When you go to clinicals, these are the main 2 things you need to bring. If you go without a stethoscope, especially to a clinical, it's like you're going out with no pants on. Make sure you never forget this with clinicals. For you to not be in pain, I recommend having compression socks. It doesn't really matter what color you wear. Depends on your school policy. I don't know if they are strict about your rules, but my school doesn't care about the compression socks because when you wear compression socks, they should be covered by your scrub pants. I recommend using this because it will help your feet hurt less, your calves most especially, although it might itch. Would you rather have an itchy leg or a painful, hurting leg? Pick the struggle. And I also recommend a trifold clipboard. I don't have one. I'm definitely going to get one after how many semesters, because I realized how convenient it is to have a trifold clipboard. I recommend a trifold over a twofold just because a trifold can fit in the scrub pants pocket. Now, if you like twofold because it's simpler, it's easier, you can do that too, but having a clipboard is very helpful, especially when you're getting handoff reports. Your school has their own rules, but for me, I personally think those are the main things you will need for clinicals. Please do not forget stethoscope when you go to clinicals. So once again, congratulations. No stress, no stress. I got you. The third category will be self-care. Why am I saying self-care? Because you need self-care. As a nursing student, if you don't have self-care, you will crash out. So let me tell you some things to prevent crashing out that you can have every time you go to school, clinicals, whatever. Hand cream, there you go. This one is the front side. I recommend a hand cream. I feel like my hands be getting dry in nursing school. I don't know what about it, but when especially they get dry? Clinicals. You wash your hands so much, you sanitize your hands so much. So if you don't want dry hands, get a hand cream. If you just want like a collection of like 12 hand creams, I put it on my Amazon. Whatever hand cream you get is going to help you. Second thing I would recommend for self-care is having headphones. I use actual wired headphones. Headphones help you be more focused. It also helps you be calm. When you have extra time in school or class and you want to do extra work, you got headphones. Or maybe you're overstimulated, you've been going through so much today, you did so many checkoffs, you did a test, headphones. And then another thing I would recommend for self-care is having blue light glasses. I'm mainly using blue light glasses actually in my job in the hospital. I'm a CNA as well. While being a nursing student, you are in front of a screen a lot. Computer screen, a phone, but it can also help you when you're studying at home, especially when you're studying at night. So for now, give some grace to yourself because you're doing the best you can. The last final category that I will need you to remember from all of this is to keep God with you. When things start feeling overwhelming, you're feeling like you're losing yourself, please go to God. You don't need to be going through the bad things for you to go to God. Just have God with you at all times, especially in a journey like this, because nursing school is not a smooth journey. Every single exam, every single checkoff, every single assessment I've done, I have always prayed to God. Before and after. I feel like this nursing journey actually brought me even closer to God because God was the one and still is the one providing me stability when I don't feel it. God is the one that I've been trusting when I can't trust myself. Especially when the multiple choice answers are so similar. I'm like, which one is it when you can only choose one? Nursing school be telling you the multiple right answers. You gotta choose the best one. I'd be like, God, I need you. This is the most important time of your life, and please do not forget who got you in it. It's God. Those were the most important things you need for nursing school, and they were not that many. It's not as intimidating as you think. Once you get into it, look at the staircase one step at a time. You will be just fine. This is gonna be the most exciting time of your life. I'm telling you. I don't regret a single thing being in nursing school. As always, don't forget to always seek things to be grateful for all around you and especially within you. Until next time, I will see you in my next video. And don't forget, all my links are down below. Bye!